how much virus is out there is a function both of the nature of this virus and all the points I just made about the infectivity of it, but it is also subject to those millions of choices that we all make. Whether we'll go to the park and not wear a mask, whether we'll sneak over and see a friend, whether we'll go to work when we've got a sniffle and we perhaps really shouldn't do that, we know we shouldn't do that. That's not a matter of blame. I'm just being upfront. That's what drives this thing. That's absolutely what drives it.
Have you heard the comments from the World Health Organisation overnight about lockdowns and encouraging governments to not use lockdowns as the primary source of suppressing the virus, especially when the lockdowns in the first wave, you were very clear that they were there to flatten the curve and get the system ready. So is the system ready, and can the lockdowns be lifted because the system is ready?
Well, we'll make announcements about easing on Sunday and up, at points in time after that. Lockdowns are not there for any other reason than to limit movement, and if you limit movement and the interaction between groups of people, then you limit the number of cases. And proof positive of that is the fact that we started on 725 and we're now at 15 cases, and we're at a daily average of 9.9 cases in Metro Melbourne. And if you look to regional Victoria and you see the fact that they did get numbers down low, and despite significant opening up, they'd like to open further, I know that, but they have opened up significantly. Those numbers have remained steady. Those numbers have remained very steady. So it can be done, it will be done. I'm just trying to be, in answer to Raf's question, I'm just trying to be as clear as I can to say this is not a theoretical exercise. This is not some doctoral thesis where we're going to keep everyone locked up till we get to zero. We will have to make judgments about what is achievable. Now, at the same time, that's not a concession to some of the commentary I see today. Oh, open up today, open up yesterday. That's not only is that, well, it's not only unhelpful, but it just completely ignores the science of this. Because I can tell you what happens if we open up on 15 cases and 9.9 at this point in time. If we open up right now, then it will be almost impossible for us to keep this thing contained. And every jurisdiction in the world that's done it has had that same challenge. So this, I understand every day here is a balancing act between trying to give people as much information and as much certainty and as much clarity as possible, but also being guided by the science of it. And I know there's a lot of pain out there. I know people are genuinely sick and tired of this year. I'm one of them. But I can't let my frustration get the better of me. Neither can Victorians. I can't stand here and pretend that it's over because I desperately, desperately want it to be. That's not leadership. Because you'll be popular for 5 minutes and then the hospitals will be overrun. And all the people out there calling for us to open up, including some members of the federal government, I might add, I don't think they'll be standing beside me having to explain why our hospital system is completely overrun. You won't see them for dust. So that's not leadership. Being popular or political, never been less important to me. We've got to see this through. We can't ignore the progress we've made. We shouldn't do that. We should not do that. We should be proud of what we've been able to achieve. And we should be as stubborn as this virus. Because if we're not, it'll be back. And it'll be back in unprecedented terms.